He may even identify himself with it and believe that he is what he appears to be.
Welcome to the NCE Study Guide.
We're really glad you could join us.
Yeah, we're all working together to get you ready for the NCE.
That's the goal. And today we're diving into the Assessment and Diagnostic Services domain.
Right, a really key work behavior category on the NCE.
And it ties right into the CACREP core area of appraisal.
You know, all that important stuff, selecting assessment tools, interpreting them, using them ethically.
Super critical for counseling practice.
Yeah.
And actually, this whole deep dive today, it was inspired by Amy from our study group.
Oh, right. Her comment about validity.
Exactly.
Yeah.
She mentioned how understanding validity better might have been at one point she needed for the NCE. It really struck a chord.
It really did. So, Amy, thank you. That insight was, well, invaluable.
Definitely. It's contributions like that make the study group so great.
Absolutely. And for anyone new here, the NCE Study Guide is put together by Glenn Osland.
Pay no attention to that man behind the curtain.
Glenn passed the NCE not too long ago. He's got master's degrees in both folklore and clinical mental health counseling.
Plus, over 6 years teaching experience at Indiana University and international healthcare work, too. Quite the background.
It really shaped the approach,
Yeah.
you know, focusing on understanding, not just memorizing.
Mm-hmm. And the guide operates on 3 core values Glenn talks about. Curiosity,
Like digging deeper for patterns,
integrity,
acting with clarity, ethically,
and connection.
growing together, sharing understanding. It's a good framework.
And Glenn calls his method an AI puppet show, which I always find amusing.
Yeah, he uses tools like ChatGPT and Notebook LM.
To take these complex topics and make them more engaging, more digestible.
Right, mirroring the kind of critical thinking you need for the exam itself. It's clever.
It really is. So if you're finding this deep dive helpful for your own prep,
Please think about leaving a 5-star rating.
it honestly helps other future counselors discover these resources. A huge help.
Every rating makes a difference. So thanks if you do.
And we'd love for you to join our free weekly study group.
It's every Saturday, 11 a.m. Pacific time.
Just shoot an email to nceststudyguide@gmail.com. You can join, suggest topics, or just say hi.
We really do love hearing from you. And it's
Yeah.
a great way to connect with other people studying.
Okay, so let's get into the meat of it. Validity, reliability, ethical use.
We want to really unpack what these mean so you feel more confident.
Let's do it. Equipping you for the NCE.
All right, Section 1, understanding validity and reliability.
Okay, so thinking about the study group again, a lot of confusion comes up around these terms, doesn't it?
Definitely. Validity, reliability, all the subtypes. People say the definitions blur together.
Yeah, and trying to recall them under pressure, that's tough. Amy's comment again. Had I known validity, that could have been my one point. It really hits home.
It does. It shows these aren't just abstract ideas. They have real weight on the exam and, well, in practice too.
So the goal here is to go deeper than just definitions. We want to build a kind of mental model.
Something accessible, even when you're stressed during the test. Understand how they work, why they matter,
Because as counselors, we're using assessments all the time.
constantly. Diagnosis, treatment planning, measuring progress.
Justifying treatment sometimes.
Exactly. These tools are powerful, but only if they're accurate and consistent.
Which brings us right back to reliability and validity. So reliability, what's the core question there?
Reliability asks, can we trust the results to be consistent? If I give this test again, will I get a similar score? Is it dependable?
Okay, consistency and validity.
Validity asks, does this test measure what it says it measures? Is it actually assessing, say, depression? Or is it measuring something else? Is it accurate?
Right, because without reliability
The results are just unpredictable, useless for making decisions.
and without validity,
Well, you could be reliably wrong, measuring the wrong thing consistently.
which is clinically problematic and ethically problematic too.
Absolutely. Making treatable decisions based on faulty information.
Yeah.
That's a serious issue.
So they're really fundamental for ethical practice, for accurate work, for evidence-based counseling.
And that's why the NCE tests them the way it does, focusing on application, on understanding the real-world implications, not just reciting definitions.
It wants to see you can think like a counselor about these tools.
Exactly. It's interesting. These concepts aren't new. They really started developing back in the early 20th century.
With psychological testing taking off, people like Binet and Terman.
Right. They realized pretty quickly they needed ways to evaluate the quality of their intelligence tests. Is this thing any good?
And that led to psychometrics.
Yeah, the whole field.
Mhm.
Researchers like Spearman, later Cronbach, they developed the statistical tools.
To measure that consistency and accuracy we're talking about.
And eventually, organizations like the APA set standards. Tests had to meet certain reliability and validity criteria.
Which is crucial. It ensures some level of quality control.
And these aren't just like academic hoops to jump through. They're the ethical backbone.
The ACA Code of Ethics hammers this home too, right?
Absolutely. Use reliable, valid tools. And make sure they're appropriate for the specific clients and populations you're working with.
That cultural piece is so important.
Critical.
Yeah.
It all boils down to acting in the client's best interest. Using the best tools we have to understand and help them.
Okay, so let's nail down the difference again. They're linked, but distinct.
Right. Reliability, consistency.
Like, do you get similar results repeatedly?
Exactly. And validity.
Accuracy.
Does the test measure the thing it's supposed to measure?
Perfect. Think of that scale analogy again.
Okay, the scale. If it shows the same weight every time I step on it,
It's reliable, consistent.
but if that weight is always 5 pounds off,
It's not valid. It's consistently inaccurate.
got it. So a test can be reliable but not valid.
Definitely. Measuring the wrong thing very consistently.
But can it be valid if it's not reliable?
Not really. If the results jump around wildly each time, how can it be accurately measuring anything specific? Reliability is kind of a prerequisite for validity.
Okay, reliability is the foundation. That's a key point. It really is. Now, something to ease anxieties. The NCE isn't going to make you do the math.
Oh, thank goodness. No calculating Cronbach's alpha by hand.
Haha, no. No formulas needed. What you do need is to tell the difference between the types.
Understand what each type of validity or reliability tells you about a test.
Exactly. And apply it. They love scenario questions.
Like, a counselor needs a depression scale. What kind of validity is crucial here?
Precisely. Or, what are the ethical risks if this test lacks X type of reliability?
So it's about function and context, not just definitions.
Right. Pattern recognition over rate memorization. Understand why it matters.
What does validity allow you to do? What does reliability allow? How does it connect to ethics?
Let's try that framework. Reliability's core question.
Is it consistent?
Real-world use.
Will this test give similar results over time or with different raters?
Okay. Validity's core question.
Is it accurate?
Real-world use.
Does this test measure what I need it to measure for this client?
Perfect. If you keep asking consistent or accurate, the subtypes become clearer.
They're just different ways to answer those main questions.
Exactly. So some common subtypes for validity.
Face validity. Does it look right on the surface?
Content validity. Does it cover the whole topic?
Construct validity. Does it measure the abstract idea accurately?
And criterion validity. Does it predict or correlate with other outcomes?
Okay. And for reliability?
Test retest. Consistent over time.
Inter-rater. Different scorers agree.
And internal consistency. Do the items hang together? Measure the same thing?
Got it. And some types are more crucial depending on the situation, right?
Absolutely. Like
Yeah.
inter-rater reliability is vital if assessment results are used in court. Need that consistency between scorers.
And construct validity is huge for things like depression scales, where the concept itself is complex and abstract.
Exactly. You need confidence you're actually measuring depression.
Okay. Any tips for remembering these? Mnemonics?
Sure. For validity, maybe CCC. Content, construct, criterion. Face is kind of the first glance.
CCC, content, construct, criterion,
All right.
and reliability.
Maybe TII. Test, retest, inter-rater, internal consistency.
DII, test, retest, inter-rater, internal, helpful.
And always connect back to ethics. Would you trust this test for a major decision?
Connecting to practice experiences helps too.
Definitely. Focus on application, not just stats.
So, quick recap. Validity, accuracy, reliability, consistency, ethics are paramount. NCE tests application, understand the function.
And use logic on the test. Is the question about accuracy or consistency? Eliminate options.
It's about critical thinking, ethical thinking. Why does this matter for counselors?
Precisely. That's the mindset to cultivate.
Okay, let's move into section 2. We're going to tackle those essential terms head on.
Yeah, the ones that trip people up. Like Amy felt, maybe focusing too much on theorists instead of the core concepts. The vocabulary itself can be a hurdle.
So many similar sounding terms, overlapping meanings. It's tough under pressure.
Our goal here is to clarify 10 key terms, definition, counseling example, and an NCE tip for each.
Let's build that confidence. First up, face validity.
Okay, face validity. Definition. Does the test look like it measures what it's supposed to? It's a surface-level check.
Like that anxiety inventory example, questions like, do you often feel worried? It just seems relevant.
Exactly. It appears, on the face of it, to be about anxiety.
NCE tip.
Remember, face validity is weak evidence. It might look good, but doesn't guarantee it is good. The NCE might present it as the least scientific type. Look out for questions contrasting superficial versus deep measurement.
Okay, good tip. Number 2, content validity.
Content validity. Definition. Does the test cover the entire range of the construct? Is it comprehensive?
Like that study skills test example, it needs to cover time management, note-taking, test anxiety, etc. to be comprehensive.
Right. If it only asked about note-taking, it would lack content validity for overall study skills.
NCE tip for content validity.
Often tested in test design scenarios. If the question asks if a test fully represents a topic or skill area, think content validity. Is it comprehensive?
Got it. Number 3, construct validity.
Construct validity. Definition. Does the test accurately measure the abstract psychological concept or construct? This looks at the theory behind the test.
Like depression or intelligence or resilience, these aren't things you can just, see directly.
Exactly. So, does the depression scale truly capture the complex nature of depression? This involves checking if it correlates with other depression measures.
That's convergent validity.
Right. And checking if it doesn't correlate with unrelated things, like, say, height.
Discriminant validity.
Yep. NCE tip for construct validity.
Look for abstract concepts, anxiety, personality, self-esteem. If the question is about how well a test measures a theoretical idea, construct validity is key.
Okay. Number 4, criterion validity.
Criterion validity. Definition. Does the test correlate with or predict an external outcome or criterion? How useful is it in practice?
And you have 2 subtypes, right?
Yes. Predictive validity, does it predict future performance? And concurrent validity, does it correlate with current performance on another measure?
So, predictive example. A career test predicting job success later on.
Concurrent example. A new quick depression screener correlating highly with scores on a longer established depression inventory given at the same time.
Got it. NCE tip for criterion validity.
Look for scenarios involving prediction, selection, diagnosis, or comparing a test to a real-world outcome or another established test.
Okay.
Makes sense. Okay, halfway through the terms. Number 5, shifting to reliability. Test, retest reliability.
Retest reliability. Definition.
Yeah.
Consistency over time. Same test, same person, 2 different times, similar results.
Assuming nothing major changed for the person, yeah. Like
Correct.
measuring trait anxiety should be stable.
Exactly. NCE tip.
If the question mentions administering the same test at 2 different times, it's almost certainly about retest reliability. Note the time interval if mentioned. Okay. Number 6, inter-rater reliability.
Inter-rater reliability. Definition. Consistency between different scores or raters. Do they agree?
Like the play therapy example, 2 therapists observing the same child with the same checklist. Do their scores match up?
Precisely. Essential for subjective assessments. NCE tip.
Look for keywords like observer, evaluator, scorer, rater. If multiple people are judging, inter-rater reliability is relevant. Got it. Number 7, internal consistency.
Internal consistency. Definition. Do the items within the test measure the same underlying concept? Are the items homogeneous? Do they hang together?
This is where Cronbach's alpha comes in, conceptually at least.
Right. You want all items on your depression scale to actually relate to depression, not, pizza preference.
Right. NCE tip for internal consistency.
Look for phrases like items measure the same trait, items hang together, correlation among items, or mentions of Cronbach's alpha. It's about the guts of the test itself. Okay. Number 8. Standardization.
Standardization. Definition. Consistent, uniform procedures for administering and scoring the test. Often includes establishing norms from a large sample.
Like IQ tests or achievement tests. Everyone gets the same instructions, time limit scoring rules, allows for comparison to the norm group.
NCE tip for standardization.
Often comes up in ethical questions, especially regarding diverse populations and whether norms apply. If the question involves comparing scores to a group or uniform procedures, standardization is likely involved. Makes sense. Number 9, norm-referenced versus criterion-referenced tests.
Norm-referenced compares your score to other people, a norm group. Criterion-referenced compares your score to a set standard or benchmark.
Like the SAT, norm-referenced how you did versus others versus a driving test. Criterion-referenced did you meet the passing standard.
Clear distinction. NCE tip.
Watch if the comparison is to peers, norm, or to achieving a specific level criterion. Common in educational career counseling scenarios. Okay, last one. Number 10, Measurement error.
Measurement error, definition. The difference between someone's true score, if we could know it perfectly, and their observed score on the test.
All tests have some error, right? Things like mood, distractions, guessing.
Exactly. Reducing error increases reliability. A reliable test has less measurement error.
NCE tip for measurement error.
It might be implied. Questions about test trustworthiness or reliability are often related. A more reliable test has lower measurement error. Okay, wow, that's 10 terms. Let's try a quick strategic recap for the NCE.
Good idea. If the question is about coverage of material.
Think content validity.
Prediction.
Predictive validity, a type of criterion.
Superficial appearance.
Device validity.
Measuring an abstract trait.
Construct validity.
Agreement between two tests now.
Concurrent validity, a type of criterion.
Consistency over time.
Test, retest reliability.
Agreement between raters.
Inter-rater reliability.
That how items hang together.
Internal consistency.
Uniform administration and norms.
Standardization.
Comparing to peers versus a standard.
Norm reference versus criterion reference.
Right. Contextualize these. What decision is being made? Predicting. Confirming. Measuring. Concerned with time. Raters.
It's all about evaluating the trustworthiness of the assessment.
Exactly. Simple guide. Is it good? Think validity. Can I trust the results to be consistent? Think reliability.
All right, time to test this understanding. Section 3, NCE-style mini-quiz.
5 questions, just like we discussed. We'll go through each one question, options, restate, answer, and explanation.
Ready. Question 1, focusing on validity type content validity. A school counselor develops a new assessment tool to evaluate students' study skills. The test includes questions about time management, test anxiety, note-taking, reading comprehension, and class participation. Which type of validity is most relevant in determining whether the test thoroughly represents the concept of study skills?
Your options are A, construct validity, B, criterion validity, C, face validity, D, content validity.
Okay, restating. Which validity type checks if the test covers the whole range of study skills?
The correct answer is D, content validity. Why? Because content validity is precisely about ensuring the test items adequately sample the entire domain in this case, the multifaceted concept of study skills.
Makes sense. It covers various aspects. Question 2, reliability type retest reliability. A private practice counselor gives the same depression inventory to a client on 2 separate occasions, 2 weeks apart. The client's life circumstances have not changed significantly, and the test results are nearly identical. What does this suggest about the instrument?
Options A, inter-rater reliability, B, test-retest reliability, C, construct validity, D, concurrent validity.
Restarting. Same test, same person, 2 different times, similar scores. What does this show?
The answer is B, test-retest reliability. This scenario is the classic definition of test-retest reliability, consistency of scores over a period of time.
Straightforward. Question 3, validity type predictive validity. A university uses a career assessment to help determine which students are likely to be successful in nursing school. The tool has been shown to accurately forecast which students complete the program and obtain licensure. This type of evidence supports.
Options are A, face validity, B, construct validity, C, predictive validity, D, inter-rater reliability.
Restating. The test predicts future success in nursing school. What kind of validity is this?
That would be C, predictive validity. Predictive validity is specifically concerned with how well a test score forecasts performance on a future criterion, like success in a program.
Clear connection. Question 4, reliability type inter-rater reliability. During a play therapy session, 2 different clinicians observed the same child using a standardized behavioral rating scale. Both clinicians assign nearly identical scores across all categories. This most clearly demonstrates.
Choices. A, inter-rater reliability, B, internal consistency, C, concurrent validity, D, test-retest reliability.
Restating. 2 clinicians observed the same thing, use the same scale, get similar scores. What does this demonstrate?
The answer here is A, inter-rater reliability. This is all about the degree of agreement between independent raters or observers.
Okay, final quiz question. Number 5, validity and ethics appropriate use. A counselor selects a standardized personality test for use with a culturally diverse client. The counselor did not verify whether the test had been validated for use with this population. What is the most likely issue regarding the test's validity for this client?
Options. A, the test lacks face validity. B, the test lacks predictive validity. C, the test has poor inter-rater reliability. D, the test may lack content or construct validity for this population.
Restating. Using a standard test on a diverse client without checking if it's validated for that group. What's the biggest validity concern?
The most likely issue is D. The test may lack content or construct validity for this population. Ethically, we must ensure tests are appropriate. A test not validated for a specific group might not accurately measure the intended traits, construct validity, or its content might not be relevant, content validity for them.
That ethical piece is crucial. Okay, how did everyone do? Hopefully working through those helped.
Yeah, applying the concepts is key. Thinking about the purpose in each scenario, eliminating wrong answers.
And asking, is it about accuracy, validity, or consistency, reliability?
That fundamental distinction helps narrow it down.
Well, that brings us near the end of this deep dive on validity and reliability.
We really hope this discussion has brought some clarity to these essential NCE concepts.
Remember, it's not just about memorizing terms for the test. It's about thinking like a counselor.
Understanding the practical side, the ethical side, how these tools impact your future clients.
If you did find this useful, we'd be so grateful if you could leave a 5-star rating for the podcast.
It really does help others find us.
And please feel free to email us, nscistudyguide@gmail.com. Join the study group, suggest topics, connect.
We genuinely enjoy hearing from you and building this learning community.
So, as a final thought to leave you with, something to ponder as you continue studying.
How could misunderstanding validity or reliability, maybe choosing the wrong test, or misinterpreting results actually lead to ethical problems in your counseling practice?
It's a heavy question, but an important one for future counselors. Something to think about.
Definitely. Mull that over. Thanks for tuning in.
We'll catch you on the next deep dive. Good luck with your studies.
1, 2, 3.